Find the term ADHD, attention deficit hyperactivity disorder, bit misleading because it suggests that you have no attention. We just have a lot of attention, but we just have a real difficulty regulating it.
Why is self-esteem so affected in people with ADHD?
That's because our brain just works slightly differently. We need to approach things differently. Always in that all or nothing mindset that we're either like doing everything, then we're kind of crashing and not able to do anything. And then we're feeling super guilty or shame. And then we're like, oh, now I need to catch up on everything.
Hi guys, and welcome back to Real the Expert series. I cannot believe this is almost done. It is absolutely crazy, but today is an episode I've been looking forward to for so long. We're talking about ADHD. If you've ever felt like you're constantly behind, struggle to get started on tasks, lose track of time, or beat yourself up for not functioning the way that everyone else seems to, this episode is for you. Today we're talking all about ADHD, especially how it shows up in women. Whether you've been diagnosed, think you might have ADHD, or simply want to better understand it, we're diving into executive dysfunction, shame, routines, habits, and some tools that can make your everyday life easier. Joining me is Dr. Janina Maschke. She's a psychologist, ADHD and executive functioning coach, researcher, and the author of A Feminist Guide to ADHD. She has such an incredible online presence and is so knowledgeable about all things ADHD, and she's truly dedicating her life to helping other women understand their ADHD better. If you guys haven't already, be sure to hit the subscribe button. Please make suggestions for any future topics in the comments below, and give this podcast a 5-star rating and review if you haven't already. It is so helpful. Love you guys so much and enjoy this episode. Okay, guys, we are here with Dr. Janina today. Thank you so much for coming on. This is such an exciting episode for me.
Thank you so much for having me. I'm super excited for this episode and to talk to you.
Your Instagram brings me life on a daily basis as someone who was diagnosed with ADHD later in life. Obviously, that's such a tiny part of all of the things you're doing, but can you talk a little bit about how you got your diagnosis and how you got started in the realm of ADHD?
Yeah, of course. So I was doing my PhD in psychology and working with ADHDers. So I was working in a child and adolescent psychiatry department. And then, of course, I was working with ADHDers, and I noticed a huge symptom overlap in the patients I was working with and then myself. And I was like, oh, that's interesting. Maybe I should get it checked out. And then I got my diagnosis, and also through the process of getting my diagnosis also as a female, and then kind of trying to find support after my diagnosis, I found that process to be really overwhelming, even though I'm from the field and I have I would say more resources in that area than other individuals. And I found it super hard. So I just wanted to make sure that I can support other people who don't have all the resources that I had, because I was working in that field and already had a lot of knowledge in that field. And also while I was working in the child and adolescent psychiatry department, a lot of moms came up to me when we went through the symptoms of ADHD in their kids, that they also recognized themselves, which made me realize that a lot of women go undiagnosed for such a long time and don't really know how to get support, if they should get a diagnosis, and also what treatment and support even looks like, especially when you're older or when you're an adult.
Totally. What does it look like as an adult? And also, this just came up for me too, is it genetic, and how much of it is genetic, if so?
So ADHD is highly genetic. It's research that suggests about 80% of it is genetic. And then there are always environmental factors that can also impact the ADHD. But if you have ADHD, there's a high chance that someone in your family also has ADHD.
Yeah, that's good to know. And yeah, what symptoms did you recognize when you were seeing it in other patients that you were working with?
So for me, it was that I had and still have a really hard time with like smaller details, recognizing that, like writing numbers down neatly in a row, for example, or that I always wanted to interrupt someone and was like really trying to hold myself back to not like finish their sentence or already like give them the answer even though they haven't even finished their question yet. Or I noticed that I was really hyperactive, but it was all like internalized. And that's why I also didn't really notice it earlier, because I always thought, oh, I'm not really fitting into that stereotype of an ADHDer. I'm like more of a quiet person. I'm not really like out there. And so it's a lot like that internalization. And then I also noticed a lot of masking that was happening of like copying someone's like behavior in some way. And I wasn't doing that intentionally. I was just kind of seeing like, what are other people doing? Let me make sure that I'm kind of fitting into that pattern of like what a person who is like doing like in school or then working, like what they should look like.
Yeah. I think it's really interesting you say that, because when we generally, like the general population thinks of ADHD, they think of a little boy, I feel like, that is running around the classroom, talking, getting in trouble. And in reality, as someone who got diagnosed with ADHD at like 19 or 20 years old, my experience was not that. And I saw signs in my childhood looking back, but I never would have pinned myself as a quote unquote ADHD person. So what are some of those? I mean, I know you just kind of discussed them, but are there other kind of common symptoms across the board that people experience with ADHD that maybe didn't necessarily feel like they were hyperactive as a child or aren't hyperactive?
So it could also be a lot of daydreaming, that you're like more on the inattentive side, so that you're daydreaming a lot. You're not really paying attention to the person like in front of you who's telling you the story. Or also I find the term ADHD, attention deficit hyperactivity disorder, a bit misleading, because it kind of suggests that you have no attention, even though we just have a lot of attention, but we just have a real difficulty regulating it. So if you're trying to talk to someone or trying to listen to someone, that's oftentimes hard because you're also noticing all these other things that are happening around you. So that's definitely a sign. It could also be a sign if you're noticing that you're very dysregulated all the time, like your emotions are kind of all over the place. If you really struggle with follow through, motivation, and then also in general, just with all these executive functioning skills, like working memory, that you have a hard time remembering where you place things, that you like forget about items that you don't see anymore, or that of course you have trouble starting a task, that you have trouble with impulsivity, that you're interrupting people, or you have a really hard time waiting in line. Like these are all symptoms that can, of course, show up always a bit differently, but are very common.
On the technical side, why is an ADHD brain and the way that it operates different from a typical brain? Like what's going on kind of in, like, I guess the chemicals in our brains, why are they different, and kind of how does it work versus a neurotypical person?
So there's also still a lot of research ongoing to like find out all of the details about it. But so far we know there is that the hormone or chemical dopamine that is highly affected. And dopamine is there for like regulation, for motivation, follow through. And that is impacted with ADHD, that is metabolized much quicker than in someone who doesn't have ADHD. And then also there is the frontal lobe that's impacted as an ADHDer, and the frontal lobe is kind of our management system of the brain that houses all the executive functioning skills. So starting tasks, finishing tasks, like all the symptoms that I basically just described.
Yeah. So you say executive functioning. I feel like executive dysfunction has become a huge buzzword, especially on TikTok, on like Reels. I always see people talking about this. What is executive dysfunction? Like, why are people with ADHD experiencing this so severely sometimes?
Because that's exactly what's affected. Like the frontal lobe also in ADHDers develops slower.
Mm-hmm.
So it develops about like 5 years slower. So people are kind of 5 years behind in the functioning skills, but that kind of follows through on a lifelong basis. Unless, of course, you work on it, then it can get better. But executive functioning challenges is when you just have challenges with these executive functioning skills.
Right.
And that also doesn't mean that you now can't do anything that involves executive functioning. It's just for some people, certain executive functioning skills are much harder to handle. So for example, like most ADHDers I work with struggle very much with task initiating. So they procrastinate a lot, or emotional dysregulation, like they are very dysregulated when it comes to their own emotions, impulsivity, cognitive flexibility, all these things.
Yeah. When you talk about the emotional kind of like dysregulation, I really relate to that. And I don't know like how to explain it, but I am a type of person that like can't keep the apartment clean because I have trouble keeping up with the mess. But then the level of like internal pain I feel when my apartment's a mess is like also so hard to tolerate. So it's kind of a vicious cycle of like being messy, but then not being able to clean it up and then going through the cycle again and again. How do you work with your patients or clients when they're going through something similar to that?
So that's actually something that's super common. Most ADHDers struggle with, because we do like or most of us like it when it's kind of when the apartment, house, room is clean, because then it's also, at least when your like room or desk is even clean, it feels like at least that is kind of okay and organized, because in your head there's still so much like chaos going on. But then of course, like doing that or doing any kind of routine can be really hard as an ADHDer. And a lot of what I work on with my clients is just understanding like what is ADHD, what are executive functioning skills. And because most people are neurotypicals, we are also taught kind of the neurotypical standards, or like how things are done as a neurotypical, but because our brain just works slightly differently, we need to approach things differently. And the same strategies that you were maybe taught in school don't necessarily apply to you as someone with ADHD. So it's all about understanding and learning how can you work with your brain and with your, like, for example, executive functioning challenges.
Yeah. Why is it also that procrastination hits ADHDers so hard? And we just had an episode previous to this about perfectionism, and I feel like that really draws into it too. How does that all draw into each other?
So kind of what you just said about the perfectionism, that's pretty much what all of my clients struggle with. Every one of them struggles with perfectionism and wants to do everything perfectly. And of course, that can have a lot of reasons, but also a lot of ADHDers have received so much criticism in their lifetime, or being told that they're doing things wrong, or they should be doing things differently, they should be behaving differently. So that has made a lot of ADHDers develop that perfectionism and wanting to do everything perfectly, or wanting to do everything like maybe your colleagues are doing or like your peers are doing. So that, of course, creates a huge barrier of even starting a task, because you're already so scared of failing or not doing it perfectly.
Yeah. So does the work come in kind of on the perfectionist side first, like trying to tackle or cope with the perfectionism so that you can do tasks in a more like manageable way? Or is it the reverse, like you're attacking the ADHD symptoms first? Does that make sense?
I would say it's really depending. Like when I work with my clients who show these signs. Like, it really depends on person to person, kind of what I see they struggle with most, or where it would make most sense to start. Because also then a lot of ADHDers have more of an interest-based brain. So that means like when a task is of interest, when there is urgency, novelty, or a challenge involved, it's so much easier to start. So that can also sometimes be a good starting point of like figuring out how can I maybe pair this super boring task with something more interesting, or how can I create some form of urgency or challenge to make the task also more fun or challenging.
Yeah. Can you give
So
some
that can also
examples
be.
of that? Sorry. See, I'm interrupting. It's horrible.
No worries. um, like some examples of how to make a task like more interesting and so on.
Yeah, yeah. Like, what is it called? Like habit stacking? Is that kind of what that is? I mean, that's like the term that I've seen, I guess. But yeah, can you go more into depth about that?
Yeah, of course. So some examples could be like something super simple as like watching an episode while you're folding the laundry.
Yeah.
Or I always love these like visual timers. You've probably seen them before. You can like set one of these visual timers and then tell yourself like in these 20 minutes, I will try to fold as many clothes as possible or get through this load of laundry. And that can already create a challenge. Or if you live in a shared flat, like trying to clean this part of the apartment quicker than your friend, for example. So these are some like super simple strategies to just make it easier. Or doing like a body doubling session. So working alongside someone else, or changing the environment, that can create some novelty. Or even like sometimes just adding like a new item to your desk, that can already create some more novelty. So like these small things can oftentimes already make a huge difference.
Is that because it's kind of activating the dopamine part of your brain more when you're doing the task that you like? Okay.
Yeah, exactly.
Okay. Yeah, because I mean that's something that I've definitely worked on this year, and I feel like so often habits are really hard to build as a person with ADHD. So, can you speak on that a little bit, and like how even if we want to do something, sometimes why it's so hard to get started in a new habit?
So for ADHDers, that's also just especially challenging because firstly, we really strive in kind of a routine or some sort of structure, because then we also don't always have to make decisions of, okay, what do I do next, or what actually has priority right now, and so on. But on the other hand, that also takes away a lot of that freedom of just being like impulsive and deciding in the moment of what to do. And it also takes away that like novelty, or sometimes also that interest or challenge. So it's sometimes really challenging to build these routines or habits. And I always suggest to have some sort of flexible routine that fits also your ADHD brain.
What about like the reward kind of cycle, like the habit cycle? Can you go into that a little, and how that might be helpful maybe?
So long-term rewards are really hard for ADHDers. Like we need these more immediate rewards because something that's far away basically doesn't exist.
Exactly.
So it's really important to have these immediate rewards. And that doesn't mean that like after, for example, bringing out the trash, you now need to buy yourself a new like handbag. It can also be something small. Like it doesn't really matter like how big or small the reward is. It basically the same process happens in your brain, whether you kind of now get to listen to the new album that you wanted to listen to, or a new podcast episode, or whether you're buying yourself like a new item, for example. So it's really important to also break tasks down so that you know like this is where I start and this is where I'm going. And then also having these like smaller rewards along the way. And if you're noticing that a reward isn't really working, then also that means that you're not really excited for the reward.
Interesting. So if it's not working, you kind of suggest pivoting and changing the reward into something that you finally do feel excited about that can keep you going.
Mm-hmm.
That's really interesting. Yeah. So you touched a little bit on this, and this is like my biggest downfall. I feel like, and I know that people with ADHD really struggle with self-esteem. I feel like so often we are so hard on ourselves because we don't function the way that a typical person functions. Why is self-esteem so affected in people with ADHD? And what can we do to fix it?
Firstly, it's kind of what I already touched on with that we receive, or so many of us receive so much criticism over our lifetime, and already as young kids in school that you're like told to sit still or don't whistle or just do it this way, don't ask so many questions, whatever it might have been. And then also as ADHDers, we just oftentimes work differently, and we're constantly noticing that we might stand out in some sort of way, or constantly questioning ourselves, like, why do we have such a hard time doing these kind of seemingly easy tasks? And of course, that really affects how you start to view yourself and your self-esteem. And this is also something I pretty much work on with all of my clients, because every one of them really struggles with accepting, firstly, that maybe they have ADHD, or accepting like what it means to have ADHD, and that certain things might be more challenging for someone with ADHD.
Yeah. I see that like in people that I know that have ADHD, and also myself, there's that resentment kind of, like there could be an external resentment of who diagnosed you, or your parents not knowing the right approaches, or we'll get into this later, but for me, it was the way that medication was approached to me, and not any type of like coping skill. When you're talking to your clients and they're kind of going through that resentment, is it really the acceptance piece first that you go into? Like, what's the first thing that you're kind of approaching when you hear them talking about this deep resentment that they feel, and kind of this overall, I know for me, I've felt like the word incompetent comes up a lot. Like I feel incompetent.
Yeah. And that's unfortunately super common. And of course, for every person, it can be different. For some, it's also that grief after getting a diagnosis later in life. For others, they have been diagnosed as kids, but then we're constantly told this is something you need to change or fix, or kind of take the ADHD away to be a quote unquote normal. So there are definitely different ways that can show up, but it's also something that many ADHDers really struggle with, and also something that's so important to work on and to understand, like, maybe where is that kind of coming from, and like, what can we do to make sure that you are also seeing like what are the strengths that you have, and what are you really good in. And also, it's always so easy to focus on all the things that might be challenging to you, and then forgetting about all the things that you're actually really good in and that make you unique, or where you really stand out.
Yeah. I want to talk about that a little more later too, because I think it's important that we end with the positives of ADHD. So I definitely want to circle back to that. You talked about masking. I need to get into this because this is kind of a new term to me, but something that I've probably been doing for a long time. I know you briefly touched on it, but can you go over how masking can show up for people?
So masking could be, firstly, that you're hiding certain behaviors. So it could be like your hyperactivity, that you're maybe internalizing that more. Or if you're like stimming to regulate yourself, that you're also hiding that. Could be that you're copying other people's like behaviors, how they talk, how they're like moving their body. Could be that you're pretending that you understood instructions even though you didn't. So it's really about masking all that comes with ADHD, or all that, like masking your struggles and kind of pretending on the outside, and maybe even to yourself, that everything is okay and that you just need to kind of pull yourself together, or just follow through and then things will be fine.
Yeah. When you talk about stimming, I obviously never knew that that was what I was doing, but why is it that people don't associate it as much with ADHD than, like, for example, autism? I feel like you more associate stimming with that and you hear it along with that. But with ADHD, I feel like it's treated almost like not extreme enough, where, like, I don't know, it comes out, but people aren't really addressing it.
Honestly, I don't know why it's taken so long for people to also recognize that stimming can be part of ADHD. Of course, there's also just like recently more research into these areas, and also now there has been more research on like how does autism spectrum disorder maybe overlap with ADHD, and also in the recent years you're now able to get a dual diagnosis for ADHD and autism. So it's definitely also due to the fact that there just hasn't been as much research, and that people have really, I guess, put it into these different categories of like stimming is more for, or is like autism, and then maybe fidgeting is maybe something that someone with ADHD does.
Mm-hmm.
But I'm also really happy that now there has been more research in these areas, and also now people are seeing that stimming is something that also individuals with ADHD do, and that this isn't something that is bad and can be really helpful. Of course, always depends like how you stim.
Yeah. Can stimming be kind of talking to yourself or singing, or kind of just like in a way that you're kind of just like talking, I guess?
Mm-hmm.
But like you're not talking to anyone.
Yeah. Stimming is basically a way for you to regulate yourself. And that can be done in so many different ways. It could be done by kind of moving your hands, or in these like more like towards like the fidgeting area. It could also be talking to yourself to regulate yourself. It could be the humming. That's what a lot of people also do, or making like certain noises.
Yeah.
So there are different ways to stim. It's always to like regulate yourself and to regulate like your attention, your emotions.
I want to go back to masking for 1 second because I forgot to ask this. Is there a cost to masking? Like, is it unhealthy for an ADHD person to continue masking?
Yes, because of course it takes up a lot of energy to constantly pretend that everything is fine to other people, to yourself. That also is a reason why so many people don't get diagnosed or so much later in life. And it can also lead to the constant or chronic fatigue, to burnout. And yes, masking is sometimes necessary, like if you don't feel safe to show up as yourself or to show kind of your ADHD symptoms, or also if you have autism spectrum disorder, if you don't feel safe in specific environments. But I definitely wouldn't suggest that you always mask.
Yeah. And then does ADHD show up sometimes alongside learning differences, or can it be mistaken sometimes for a learning difference when it's ADHD?
So it's both. ADHD in general, there are or has a high prevalence for comorbidities, so other mental health diseases or disorders like learning disabilities that come alongside ADHD. But then also ADHD is often mistaken for other things like learning disabilities, depression in general, a mood disorder, anxiety, and so on.
Yeah, I see kind of, I mean, I guess from online a lot, I've seen a lot of people speak about ADHD coinciding with mood disorders. How do you tell them apart? If ADHD shows up sometimes maybe like with symptoms of bipolar or, like you said, depression, how do you tell them apart?
So firstly, there's a difference whether like you actually have these different like mood disorders and ADHD.
Yes.
then it's also sometimes really hard to tell them apart.
Yeah.
And I would also say it's not really necessary to really be specific on saying like, oh, this is like my anxiety showing up and this is my ADHD that is showing up, because a lot of times they just also overlap.
Mm.
And then on the other hand, there's also sometimes that maybe especially like undiagnosed ADHD is kind of coming up as anxiety. And like once you have been treated for anxiety or that has gotten better, that then you or your healthcare professionals are noticing, oh, there's also like underlying ADHD that we need to focus on now.
Mm-hmm. That's personally what happened like on my journey. I was diagnosed, I lived with general anxiety disorder my entire life, as listeners have heard a million times by now. But I was diagnosed with ADHD the same time that I was put on medication for anxiety, but we just weren't ready to treat the ADHD yet, with me just going on medication for anxiety. And then later on ended up being treated for ADHD. I want to get into medication because for me, I had a lot of trouble with finding a medicine that was right for me, and actually never found a medicine that was right for me. I was put on stimulants immediately. I was never given a handbook of what to do and what this diagnosis meant. And I didn't really know anyone that had ADHD that was diagnosed as an adult. It was either people in college that were taking Adderall for class and they maybe didn't really have a diagnosis, or people that grew up with it, so they've just been on the medication their whole life. Can you speak to like what medication, what the effects are and what the sometimes downsides are to going on a stimulant?
And of course, that's also always a very individual decision, and everyone reacts very differently to the medication. But also what I've witnessed, like when I went through my diagnosis and then treatment, and also what I see in some of my clients, is that healthcare professionals are often very quick of prescribing medication, but not necessarily offering alternatives. Or then maybe they say there are alternatives like therapy or coaching, but then it's really hard to actually find a professional who specializes in ADHD, or also someone then who has the availability and takes on new clients. So that's also then accessing that part of the treatment can be really hard. But then for medication specifically, and specifically stimulant medication, kind of what it should be doing, the like positive sides are that you should be able to regulate your attention a bit better. It should be easier for you to transition and start tasks again, to follow through, to be less impulsive, to feel just overly more balanced also with your emotions. And then with every medication, there are also potential side effects. And for some, they don't come up. For others, they come up mildly. And then there's unfortunately some where they're very present. And then it also, you really need to think about like, do the benefits outweigh the side effects or vice versa?
Yeah.
And some of the side effects could be that it affects sleep, because it is a stimulant medication. It can increase blood pressure. It can then also increase anxiety. So a lot of individuals who have anxiety often find it really hard to take stimulant medication, because then sometimes it feels like the anxiety is increasing, or then the anxiety is increasing. It can affect how like your eating behaviors, your hunger. So and also like headaches, dry mouth. So it can have a lot of different side effects, and again, can really show up very differently for everyone.
Yeah.
Which is also sometimes really hard, because when you finally gotten a diagnosis, then sometimes you have to do a lot of trial and error of testing and finding a medication. And then sometimes you find out that none of the medication really works for you.
Yeah. For me, it's been a adult lifelong journey, a 20 to now long journey, 20 to 29. So it's been a journey. I also think that like the Wellbutrin, the like that category of drugs they're kind of like I guess they're the second like level of people. The first line of treatment is stimulants, and then the second line of treatment is like Wellbutrin, Strattera. A lot of the time, those, for me personally at least, those also caused me a lot of anxiety. So when you feel like you're kind of out of options, where do you go next? Like, how do you find, it's like, so you're right, it's so hard to find people that specialize in coaching. And why is it important to find someone that's an ADHD coach versus going to therapy?
So you can also definitely go to therapy. I would suggest to at least find someone who specializes in ADHD.
Yeah.
So anyone who is specialized in ADHD, and the same for coaches, someone who is specialized in ADHD and ideally also has some more training around it, because there is no like certification required or certain like pathways required for coaching. So anyone could be a coach. But ideally finding someone who knows about ADHD and specializes in these areas, because as an ADHDer, how you're approaching life is very different. And also the solutions and tools and strategies that you need are very different versus someone who's neurotypical. So someone who doesn't have ADHD.
Yeah. When it comes to substance use, substance misuse, I read that people with ADHD are more likely to struggle with substance abuse. How does that play into stimulants? I know, again, I'm going to bring in my own experience. I was on stimulants for a while and I was like, okay. I was having terrible side effects, but I was okay. And then I began to really love that kind of almost high feeling and that dopamine hit. I think maybe I was being overprescribed or my dosage was too high, and I struggled for a really long time with misuse of stimulants. Do you see this in clients, and why does it happen more with people with ADHD?
So for ADHDers, like a symptom is also impulsivity, and they have a higher chance of risk taking or like taking risks. So that can just overall increase already the challenges when it comes to misusing things or dependency. And then also kind of that search for dopamine can also really increase it. And then also because you're maybe masking or just trying to find ways to cope with life, that can just all increase your tendencies to misuse different types of substances. And research has shown that if ADHDers actually take medication and are in treatment, that their misuse or dependency decreases. But of course, it's also always really important to really monitor what you're taking to make sure that you're not overtaking of what you're being prescribed and so on. And then also within stimulant medication, there are different stimulants that you are being prescribed, and there are methylphenidate, which is more like Ritalin, and then there's Adderall, which is more amphetamine based. And how they react is also very differently. So for example, in Europe or in Australia, you might, like your first medication that is being prescribed to you is more than methamphetamine, so Ritalin, versus in the US, it's oftentimes Adderall. And that just also increases your dopamine and then also slows down the metabolism of dopamine, versus Ritalin. It just kind of slows down the metabolism of the dopamine.
What happens when someone who's been on a medication for a really long time wants to get off and does get off?
Again, that really depends on what type of medication they're taking.
I'm talking about stimulants, sorry. That should have clarified. Yeah.
And then it also, again, depends on these two medications that you're taking. But generally, it's suggested that you kind of slow down or like decrease your dosage and then like try it out. Or also for some individuals who just take it every now and then of course it has a different effect when you're suddenly stop taking it, because your body is not used to always taking it. But if you all of a sudden stop taking it, you can feel just very fatigued, and some also get headaches. Again, really depends on the type of medication that you're taking and also the dosage that you're taking.
Yeah. What is your advice for someone that has come off of the medication, even if it was in the perfect way, and they're just still dealing with pretty bad side effects and just feeling like overall their ADHD maybe even got worse after than before they even started the medication?
So in general, like even if you're on medication, I always suggest that you don't just rely on medication, because that's just one treatment approach, and a combination treatment is always the best. But then especially if you've now come off medication, it might be even more helpful or necessary for you to find other ways of treatment that really support you. So that could be therapy, it could be coaching, it could be just building a support system. And again, even if you're taking medication, I would suggest that you're doing all of these things.
Yeah. For someone that is trying to develop like a better lifestyle, and maybe they're unmedicated or even medicated and just trying to cope better on a daily basis, what are some habits or a bit of routine that they can toss in that might not feel so overwhelming that could really help their symptoms?
So like some of the things, I guess, that we already talked about, like kind of working more with that interest-based brain of like making sure that there is some novelty, some interest, urgency, challenge. Accountability, like the body doubling, that's super effective and something that you can also incorporate fairly easily. You can create kind of a launch pad, like a place where you locate like your keys, like everything to get out of the door, to make sure that you have also these visual reminders, because once something is out of sight, it's really out of mind for ADHDers.
Yeah.
So that can be really helpful. To also like externalize time, because we really struggle with time management and seeing time. So like having these like visual timers or having clocks around, using auditory reminders like alarms to just signal like this is the time now, or now it's time to like transition out of this task. And to maybe have certain routine pillars set, so not a super structured routine that plans out like every minute of your day, but having like certain pillars during the day that help you to transition into your work, or for you to recognize, okay, now it's lunchtime, now I'm taking a break, and now I'm transitioning back into work, or like a routine pillar after work to know like how do I transition out of work as well, and to make sure I still have time for like hobbies and so on.
What do those pillars look like? Like what could that be?
So it could be something like super simple and kind of goes with that habit stacking that you also mentioned earlier, is like that, like in the morning when you always have breakfast, you're also taking your supplements or your medication, or that's when you're also packing your water bottle so that you have like water once you go to work or whatever you're doing. Or to know that always in the morning you include some movements, whether that's like actually working out and like going to the gym, for example, or going for a walk or doing some stretches. So knowing that there's also some flexibility, but knowing there's like some kind of movement, for example, happening, or that there's like breakfast happening, and kind of that's your morning routine.
Can you talk about exercise and other kind of natural dopamine boosters that you can do throughout the day? I know one for me is like a freezing cold shower for 30 seconds. That really is powerful.
Yeah, that's amazing. And then also like moving your body. That's something that I always suggest to everyone. If you're able to do that, just moving your body. And that doesn't mean that you need to be, I don't know, a runner or go to yoga or anything like that. It's just moving your body and also going outside, sunlight, knowing what actually excites you, like what are things that you really like, whether that's like going on a walk or doing like doodles or drawings. Like it can be something super small, but knowing what you actually like and kind of incorporating that throughout the day or at some point during the day, that can be really powerful. Or also, like you said, like the cold shower, that can be awesome.
Yeah. Kind of a psycho thing for me to do, but like it actually really does help. I'm like, I'll do anything. And if you think while we're talking of any like any really unhinged hacks for ADHD or just like that quick fix, let me know, because that's like what I currently am thriving off of. I feel like it really helps me just like cope in my day to day. So if you think of anything as we're talking, shout it out because it's needed.
I will.
So I heard Paris Hilton talk about this actually. She's been like a huge advocate for ADHD, which is amazing. She talks about emotional what is it called? Rejection sensitivity, or RSD, I think. Can you explain what that is?
So RSD stands for rejection sensitivity dysphoria. And that basically means that you react very intensely to any kind of rejection or perceived rejection. So even if you feel like you're being rejected, so for example, a friend isn't responding to your text right away, you maybe logically understand like you're not being rejected, but it really feels like now your friend doesn't like you anymore or doesn't want to hang out with you. And that can feel very, very intensely and deeply for individuals with ADHD, because we also tend to feel emotions just more intensely. And that's also a big reason why some ADHDers really have trouble starting certain tasks or projects, because you might feel like you're going to get rejected, or looking for a new job, or trying to find friends or new friends because you fear that you are going to be rejected. And of course, that impacts, again, all areas of your life.
Wow. I really love how you connected those two, because I honestly didn't think of those being connected. But if you are struggling with that, how do you overcome it? Like, what's the first step you can take if you're just really scared to start because of that underlying fear of rejection?
And that's also something that I work on with my clients like for a long time, because it's such a huge topic. And if you're feeling this feeling so intensely, of course, it's also super scary. So also don't feel bad or feel like you're a failure if that's something that's like constantly showing up everywhere. And it is unfortunately very common for us ADHDers. And a lot of it, again, is just understanding yourself better, understanding your ADHD, becoming more confident in what you're doing, also figuring out like your strength, figuring out like what has meaning to you, what brings you joy, and then also like just slowly building up your confidence, your self-esteem.
Yeah. How do you build confidence and self-esteem? What are some things that you can do to build yourself up?
To firstly slowly like start incorporating things that you are good at. Maybe also trying things out and seeing that you can still do them. A big part is also just figuring out what you actually enjoy and what you like and what you're good at, because that can be surprisingly hard. It's usually very easy for us to know what we're not good at, or listing all of our challenges, but also just seeing what you're good at, that can be super hard. Or it could be something like as simple as doing a reverse to-do list, or some people call it a ta-da list at the end of the day, of like listing all the things that you actually did accomplish. Because it's so easy, again, to focus on everything that you maybe didn't accomplish and that didn't get checked off your to-do list. So also taking some time at the end of the day to reflect, okay, what did I actually accomplish? Or what was a great win today?
I love that, because I feel like especially people with ADHD, we're going to be our harshest critic. And often I end my day, if it's not ultra productive, it's not productive at all. Can you also speak to that kind of all or nothing mindset that might sometimes come with ADHD people?
And that's, again, something that so many ADHDers struggle with, that we're always in that all or nothing mindset. that we're either like doing everything, or then we're kind of crashing and not able to do anything. And then we're feeling super guilty or shame. And then we're like, oh, now I need to catch up on everything or need to do everything again. And then, of course, you're overdoing it and you're doing so much that usually not a normal human being can do. And then you're crashing again. So again, unfortunately, very common and also impacts a lot of things. And the same with kind of our emotions. It's also usually very intense and not as like balanced. So that also can take a while to just figure out like what is actually your capacity and what does your like medium capacity or medium energy day look like. And that is actually the normal level for most people. Like how can I actually aim for this and not always aim for these super high energy, high productive days.
Yeah. I really relate to that in the way that I always look at other people, especially online. Like the self-comparison goes crazy when I'm like, it seems like everyone is having a high energy, very productive day every single day. And that's just like not me. So what does that mean to have like a medium productive day? And is that true? Like, are most people really medium productive and it just seems like everyone is doing the damn thing all the time? Like,
I would say so, because no one can be like super productive all that time. And like, especially when you have ADHD and you have these high productive days, I mean, we can move mountains. Like there's so much that we do in these days, but of course that also takes out a lot of us. So no wonder that we like crash the next day or even the next week, because probably most of us didn't then eat anything during the day, didn't take any breaks. We maybe didn't even have time to go to a bathroom. And now like at the end of the day, we're running to the bathroom. So that's definitely a sign that you should have taken some breaks during the day. And it like a medium productive day is like when you're doing like, for example, these like 3 priority tasks and you're just getting them done. And then you're able to recognize that and take a break or like end your workday. And when you're more at this balance level most of the time, of course, everyone has like a high energy day every now and then or a low energy day. But if you're more stable most of the time, it's also easier to get things done on a more continuous level versus when you are just always waiting for this high productivity day. And then you're trying to get everything done. And then now you need to recover for the next couple of days or weeks.
Yeah, I find that like I'll have a high productivity day like once a month. Like literally like maybe 1 or 2 days of the month, I'm like, I'm a killer. Like, what is going on? It's crazy. And then the rest of the month or like the next week, I'll be like feeling really just lazy. I don't really want to do anything. Can hormones play a role in this? And like, I've heard things about PMDD, premenstrual dysphoric disorder, being connected with ADHD as well. I don't know if you've seen like studies or anything on that.
So that, like, firstly, that can also be connected to ADHD. But in general, your hormonal changes have a huge impact on people in general, or specifically women. And then especially if you have ADHD, that has even a bigger impact on you, because also dopamine is tied to estrogen. So when you are menstruating, that of course impacts like your estrogen and how much estrogen you're producing, and then also how much dopamine you're producing. So usually a week before your menstruation, your like estrogen takes a dip, and then also your dopamine takes a dip. So then you notice your ADHD symptoms way more. And then also, of course, if you're going through these huge hormonal shifts, like during pregnancy or especially after pregnancy, when your estrogen really drops intensely, your dopamine drops, and you can really, many women are really struggling. Or then also when you're going into perimenopause, menopause, of course, that also affects your hormones a ton, and then also your ADHD a ton.
Wow. So it really ties into it a lot. And as women, I feel like we have so many, as you just said, so many different phases of our hormones, even starting out with puberty. And then I felt like in my early 20s, my hormones really changed a lot. So it's really good to know that like it's a common thing and that it's just kind of something to look out for maybe. And it even just makes me feel better a little bit knowing that you can kind of look at the day of the month and say, oh, I'm going to get my period next week. I might be feeling a little unproductive and down in the dumps right now.
Mm-hmm.
Yeah.
Yeah, exactly.
I was going to go into rapid fire, but I actually have a couple more questions, like kind of mini rapid fire. I wrote down some common ADHD struggles based off of myself and some friends of mine that have ADHD. And I wanted to ask some questions about it. Number one, texting back. Why is it so hard for ADHD people to text back? Like, why is it actually paralyzing?
It's funny because you're asking that because yesterday in my group, we actually discussed that why
Really?
it's so hard. And it's definitely, again, very common. Most ADHDers really struggle with that because it also feels like this never-ending task, and kind of similarly to emails.
Yeah.
That you don't know like if the person will respond or like when they respond, and now you need to think of another response and the whole task starts over. So you can't just check it off because especially for a text, it's like so quick. Then all of a sudden now you have a new text and now you have to respond again. Or, like if you're going to respond to your friend is going to ask you like, when can we hang out? And even though you want to hang out with your friends, of course, but then you also need to think about firstly the future, which is really hard for ADHDers.
Yep.
Think about planning, think about what you could do. When do you actually have availability? Do you actually have capacity? You might know, like, usually you commit to things and then you regret it. So there are so many things that go into that.
Yeah. Okay. The next one. Oh, actually, and what are some solutions for that? Like, what's a hack? Because, like, I often find myself drowning in texts or emails and then I just never get around to it. And later I'll be like, oh my God, I missed all of these. Is there a hack or like a little tip that you have to at least help avoid the damage?
I would say if it's with friends, also just being open and communicating with them that you don't really like texting or that's very overwhelming to you. And then also trying or thinking about like what is actually easier for me. Is it easier if you actually call the person? Does that make it easier or is that more stressful? Then of course don't suggest that. But that can sometimes make it easier.
Mm-hmm.
And also just being honest or kind of accepting that you have a hard time texting and it's because of like the factors, for example, that I just talked about, or asking yourself like, why is it so hard for me to respond to this specific text?
Mm-hmm. Yeah.
Or also sometimes it can be hard because you kind of forget about your friends, not because you don't care about them, just because of that. As ADHDers, we need these visual reminders. And if something is out of sight, it's also out of mind. So you can also do something as simple as like having sticky notes with your friends on it, or having like pictures of your friends like next to your desk or like in your room, just so that you remember to reach out to them every now and then.
I love that, actually.
Or also trying to make like a text message fairly easy so that you know that there's not going to be a lot of back and forth. That can also sometimes make it a bit easier, but
no,
I think it's always going to be something that is just a bit more challenging.
Yeah, constant struggle. Okay, another question. Why is it so tiring doing even one task a day with ADHD?
So firstly, it's that like changes in our energy and capacity. So maybe it's because you've had a lot of like these very high energy days and now you're kind of really fatigued and exhausted. And then on the other hand, it also certain tasks, and a lot of these like again seemingly simple tasks, like maybe brushing teeth or like the texting back or taking out your trash. It might just seem like one task, but there are so many things tied to it that you like need to remember. You need to transition out of the task that you're currently doing. You need to actually initiate the task. You need to, for example, if you're taking out the trash, remember to put in a new trash bag,
Yeah.
or then there might also be that sensory component that you don't really like to touch the trash bag. And like all these factors can tie into a task that makes it so much bigger than it might seem like it is.
Yeah. Okay. We're going to do a rapid fire, 3 rapid fires, and then we have to talk about why ADHD is a superpower. Okay. So what is one thing you should never do with ADHD?
That's a good question. I would say talk negatively towards yourself, but of course that's very hard.
Honestly, real. Like, that is real. We all need less of that. Can ADHD get worse with age?
Not necessarily. It really depends on your life circumstances and how that changes.
Is ADHD overdiagnosed?
Again, not necessarily. Like the research suggests no. And there's also still a lot of people who haven't gotten a diagnosis or been misdiagnosed, like individuals identifying as female or people of color, different, like people who don't fit the typical ADHD type.
And to wrap, why is ADHD a superpower?
So I always stay away from like saying like ADHD is a superpower, because there is also a lot of these challenges tied to it. But also as ADHDers, we just have a lot of amazing strength that we often don't recognize, or we're often so stuck in all of these challenges, and because these things are so hard that we don't even have time to kind of invest in our strength or even think about them. But a lot of ADHDers are super creative. They are often out of the box thinkers, have amazing ideas. They can have, like, if they're managing their ADHD or have found treatment that works, have really high energy. They can respond really well in like crisis or like emergency situations. They're very empathetic and can really feel for other people and kind of know what they're going through and understand that better. A lot of ADHDers also become like self-employed and start amazing things. And I don't know. Can I think of anything else?
That's a lot of reasons, honestly.
Yeah.
No, I appreciate ending on that, because obviously with the struggles, like, we're all going to feel down on ourselves sometimes. But I also think that in my diagnosis journey, I have learned that it can be who I am in a good way. And like you said, the creativity and the out of the box thinking, and sometimes being thought leaders. So many CEOs have ADHD. So I appreciate and think it's important to always weave in the bits of good that come with it too.
Definitely.
Thank you so much for coming on and letting me pick your brain and ask you a million questions. Please tell everyone, what are some resources they can reach out to if they're struggling, and where can they find you as well?
So you can find me on my Instagram, TikTok, YouTube, website, all under ADHD Empowerment Coaching. And that's also where I have a lot of free resources, free workbooks, blog posts, also YouTube videos that just go deeper into a lot of the topics that we just touched on now as well.
Amazing. Yay. Thank you so much.
Thank you so much for having me. It was amazing to talk to you.